ago by a number of organizations, about 50 of them, and to ask the question of what we can do more effectively to really get affordable health care to all people in the country. Jim was actually at the first meeting. It was a great meeting, but what we decided though is we need to really connect with American people. And one of the things that we talked about here so far today has been the problem of us creating demand, making sure the public knows. We talked about ignorance. We talked about a number of things where people just don't know what's out there. How is this going to affect them? Why is healthcare important for them? The whole concept of this marketplace is one that I think throughout the country people can't understand because they have no idea what we're talking about. And we have to be able to communicate about them to create that demand. And also from the discussion earlier that I think we should really focus on is that while we talk about social justice, we care about that. A broad range of people, a lot of the voters that are out there aren't us. And we have to create, they talk about creating power. They talk about having influence over what goes on. That means communicating well with your own friends, with your neighbors, with your own families. But it also means communicating with other people, people who aren't necessarily your own, in your own group. And I think when you want your legislators to have power, you have to make sure they have friends they can turn to who will be on their side. So we have to motivate our base, we have to talk to the persuadables, and we have to increase that demand for everything we get out of the Affordable Care Act. You know, the Affordable Care Act is actually the biggest social improvement for women, for Latinos, for African Americans of almost any bill that I've seen in my entire career, having worked in healthcare now for about 40 years. We have the opportunity to make this into something really good. We talk about the access parts, which are absolutely important, but you know, all these details. We talk about the marketplace. We talk about all the how we have more effective care, how we actually organize services so we're more efficient, so the doctors, like me, can actually provide better quality care. That's embedded in this bill. I mean, the beginnings of that process. When I was in George Mitchell's office, we actually started the whole area. We called it outcomes research, which is actually effectiveness research. And it was the first bill I wrote and actually got through. The impact of that was just the beginning, scratching it, the surface. And now we're talking about actually taking services and looking at them and figuring out what works best for our communities. And I think that's really a huge advance. From a doctor's point of view, you know, oftentimes we make decisions which are, say, based on our experience, our history, not necessarily based on science. And I think it actually is a benefit here. We're actually going to improve the system, make it better for you and your families. So, that all said, I want to turn to a little bit about how we actually talk to the public. That's my job today, is to talk about how do you actually communicate all this stuff. And I think it's really a very, I don't think it's really rocket science, but it's really important and it's really discipline. And I think some of the earlier speakers talked about it a little bit, is that when you are communicating to somebody, you have to talk to them. Let's say when you're a good communicator, it's somebody who listens to you, then talks to you about what you care about. Jim mentioned it. People care about the personal. This is healthcare. I care about what's going to happen to my family. We have to make sure when we talk to other people, we don't get into the details of all the facts and figures and stuff, but we talk to them about what they care about. And there are different audiences. There's the public. And within the public, there are different groups. We also have the legislative discussion, and it's a different conversation, as a number of people have mentioned. When you go talk to the editorial board, it's a different conversation. But right now, I want to talk about how we communicate with the public more generally. There are a number of issues up right now. We talk about the ACA and all the things having to do with it, but it's really Medicare and Medicaid are being both hammered by the national debate, but also at risk. As you know, the basis for a lot of the expansions and the benefits of the ACA are based on a Medicaid expansion. They're based on making sure Medicare is improved. In fact, there are huge improvements for both of those programs. So, our challenge. And this is a challenge, I think, that we can actually win. This is the interesting thing about this. There was a poll yesterday that came out, or I guess it was yesterday, from the Kaiser Foundation, which said one more time, which we have actually numerous polls we've done in Missouri to national to California, no matter where we've done it, it's always been the same. And that is that American people are just a little bit down about what is this bill because they see the politics of it and they hate the politics. But when you ask them about what's in the bill, how is the issue of the pre-existing conditions and making sure there's access, all these pieces, how do they affect me? They're all between 70 and 80%. People really love what's in the bill. I'll say love. They really think very positively of it. They care about it and they want it for them and their families. So our challenge is, how do we talk about this law? How do we actually communicate about this law so that actually we win those debates? And the interesting thing about all of our work that we've done that I'm going to show you, but also other people have done, and we steal liberally, is that you can win the debate, but you have to have the debate, you have to engage it the right way. And we also have to, the question today is, how do you support Medicaid and Medicare? I won't spend a lot of time on that, but those are very important issues and ones we actually win on quite dramatically, actually. And one of the last things that I want to talk about is how do we respond to the attacks? We're getting hit by a lot of attacks. Interestingly, we win if we do it the right way. We lose if we do it the wrong way. And I think this is a matter of us becoming more disciplined and more focused about what we do. So the opportunity, the ACA, ooh boy, this is really, we're going to talk about this, you can support the champions, and there are champions, and I'll tell you about them. There's a huge uninformed base out there that is and by that I mean these are groups that you know, you like, they like you, but they don't know what's going on. And those are the people you need to reach out to. Also, you can move independence fairly substantially. And lastly, you can really deflect your critics. Now, this is interesting. When we look at support for the law initially, it's about a -7 overall. This is the law. If you inform people, you move to a +20. And that is really the key issue. The final, by informed, after informed, we take all the arguments and we say, okay, this is all government, socialism, crap like that. And then you go back with our arguments. We still win. We lose a little bit on that argument, but we're still ahead +17. And the point is, we have to get to +17, if you want to call it the numbers. We have to have support behind it. So when our legislators are talking to their colleagues, and actually want to know the truth, when their colleagues are talking to their constituents, those constituents care about it. And that's very important. So the opportunity. First of all, Medicaid and Medicare are winning issues. When you talk about them the right way, 85% of the people support them. And that's too many things. But the issue about this is that we need to talk about people. We have to talk about, for instance, with Medicare or Medicaid. Medicaid actually rates higher than Medicare, which is unbelievable. As a person who has seen the politics locally, Medicaid's always beaten up. But Medicaid is supported more than Medicare when you talk about who you're taking care of, when you're talking about grandma in a nursing home, when you talk about kids, when you talk about disabled people. I mean, the guy who went to California Endowment one time said, this is the Jesus program. I mean, this is what Jesus actually supported. I mean, it's really quite, I'm amazed that people beat it up so badly when we talk about being a Christian nation. Oftentimes, I don't call it that, but. So, let's go on here. The cluster analysis. What we try to do is figure out who are we talking to. We broke up the American people. This is a recent one. We've done it a number of times, but this is really talking about the ACA and looking at it. And there are groups here. One of them is the cheerleaders. These are about 22% or a quarter or a fifth of the population. And these people are already on your side. They don't really know what's in the bill, but they're going to vote for you. They're going to be on your side. They're going to support you. You're the ones you can call up and they'll come out for you. They're more female, more democratic, much more democratic. They're younger, and they tend to be a little more educated than the other groups, have more education, I should say. The uninformed base, and this is probably our biggest opportunity right here. This is a group of people, about over a fifth of the population, again, who actually, when we did this division, are completely, 100% of them did not support the bill. 70% were unsure, 30% were against. After you just tell them about the bill and have the arguments, 64%, going from 0 to 64, support the bill and what's in it. Now, this is a group where if you talk about getting to and talking about what's in the bill and how it's going to affect them, this is huge. And so a lot of these people have not gone to college. They're they're plurality Democratic, but they're not overwhelmingly Democratic. There are a lot of Republicans in this and a lot of independents. And they are more female. Now, I agree, this is going to be a bit of a theme. Most of the people that we can move are actually female and not male. It's 60-40 about. And not that we turn our back on men at all, but we just have to understand that we need to also speak to women very clearly. There's another group, about another fifth, which a little less than that, but that is results oriented. They're looking around, they're asking, well, what's in the bill for me and my family? And so they're the ones where you have to really show them that this is going to make a difference. Now this group listens to both sides of the argument. They listen to the negative arguments as well as the positive arguments. In other words, they kind of say, well, is this too much big government? Is it too much taxes? Is it going to ruin my life a little bit in another way? Does this really fit with the problem we have, austerity and all these other things? But they're also the group that really care about what's in the bill. Talking to them exactly what's in the bill for them, it moves them dramatically, and we need to do that. A tougher group is the cost-conscious ones, and these are a group of people, another fifth, who are really skeptical that this bill will save money. And I think and we'll talk about a little bit about arguments or discussions about costs in this thing, because this is the arguments against this are basically, it's big government, it's socialism, whatever that means, in other words, taking away individual rights or whatever. But it's also that this is just too costly in a time of austerity or a time of tax cuts and everything else. And we have to make the case that this is actually, it's penny wise, pound foolish not to have this in place. And in fact, if you look at everybody who talks about what's going on with the national budget and how we're going to make it balanced, says that we have to really confront healthcare costs. And if we don't do it, we're in real trouble. This bill actually approaches healthcare. You have two ways of doing healthcare costs. You folks who are in the legislature work there. You can either just cut benefits, cut doctor fees, cut whatever it may be, cut individuals off, or you can actually change something to do with the substance and the way we deliver healthcare so it's one, better quality, and actually can come in at lesser cost. And we can do that. We've proven that in many places, but you have to make changes to do that. And this is a group we have to meet on that. There's a group about fifth that you'll never persuade no matter what you do, and I just say don't break your pick and don't waste your time. And I hate to say they're mostly male. You have to know your opposition. Your opposition is, and this is just taken from a recent memo that came out from probably our arch enemy named a guy named Frank Luntz, and I don't want to, and I'll give him a ton of credit because this guy is extremely smart. He understands everything about communications. He understands how people react to fear. Fear makes them very conservative. They worry about things. He likes to engender fear. He's the one who gave us partial birth abortions, clean skies, I think they called it. Go down the list. He was a pollster for Gingrich about 15, 20 years ago, and now he does very well, but he is really the man behind the words that the Republicans use. He comes out with something, and we actually timed it one time. It was 8 hours after he put out a memo and had a briefing that we had 3 or 4 different congressmen using the exact same words filmed, and it was really quite impressive. And so what he actually came out lately, and probably the biggest thing that's given me more hope about this is that the 99%, the occupiers, whatever you want to call them, have really changed a lot of the debate. And I got, and this is really quite impressive at what's happened with the discussion, because I've been talking about all this problem about our taxation system for years. Nobody cares what I have to say, but now it is actually a subject in the national dialogue. The fact that low-income people pay a lot more than upper-income people, and the upper-income people have been a huge change where their taxes have been cut, and lower-income people, their taxes have been increased. And it's the social justice issue. It drives everything. And one of the reasons we have a lot of the problems we have now is that working people have been working harder and harder. Women have gone to work, they've hawked their houses, and they still have not made more money. And our productivity is up dramatically, and our incomes are not for almost all of us. But interestingly, he does a lot of polling, and he found that people, and this is what he says. Okay, this is not what I say, but this is what he says. that is the problem. He says people don't think capitalism as a word is very good anymore, it's immoral. And he wants everybody to use economic freedom. I would suggest sometimes that we, as we go through these, that we think about how we talk about different things. But, you know, capitalism, you know, we can say we like capitalism, but we got to make sure it works right. On defending Wall Street, he doesn't think we can do that. But so he says, just change it, the problem is Washington. I think we have to make sure that when we talk about defending Wall, when people bring up problems with the economy, there's a Wall Street problem. Also, there's an insurance problem. Both of those run together. They both reside in the same street. He talks about we shouldn't talk about taxing the rich, but taking from the rich. I think when you talk about developing a resource or a fund source for something, if you have, people support very much taxing people over about $250,000. And so if you talk about taxing people for well-to-do, it actually does resonate and people do care about it. On the middle class, he wants us to get away from talking about the middle class because that's you, and he wants to change it to the hardworking taxpayers. I have no problem with hardworking taxpayers, but the point is the middle class, people believe in this country the middle class is being eroded, and I think we have to keep going back to the idea that the middle class is being eroded. We got to do something about it. And you know, while we care about taxes and taxpayers, we want to make sure that the middle class doesn't get taxed. When they're trying to obfuscate it by saying hard-working taxpayers, which means, you know, high-income people who pay a lot of taxes. And the interesting thing, they want to move it off jobs. Jobs are very real and practical. And very honestly, they want to talk about careers. My point there with careers, you can't have a career without a job. And the reason jobs are really resonating is that people need jobs, they want jobs, and that's the first practical thing you do on the first step to a career. They don't want to talk about government spending, but rather waste. They actually are afraid of the contents of the law, and they don't want us to talk about pre-existing conditions, about the prevention that's in the bill, and about reining in insurance. Those are issues they lose on. And what they want to talk about, deficits, tax cuts. The big debate right now, the Uber debate, the overall debate, is whether we have basically a deficit problem or we have a jobs problem or a economic problem. And what everybody's, if they win the debate, very honestly, if it's a deficit problem, we are going to end up having cuts no matter what, and we have nothing left. If we talk about jobs, humans, healthcare fits in that, then we win the debate. And very honestly, American people are over here in the jobs and the healthcare and a better life for them and their kids. Very important to remember. Personalizing, they don't think we should personalize it. They want to talk about irresponsible others. We had talked a little bit about immigrants here. You can't believe how much that's embedded in the population, that every time you talk about a problem with the healthcare system, everybody points to illegal immigrants. I do want to make a comment on that because we did a lot of work with the immigration groups trying to figure out how we actually talk about this issue. And very honestly, I want to go through different groups, but we were able to move every group into being under a group that people would really support as far as healthcare. The group that's being really disparaged right now are immigrants who are legal immigrants. I don't know if you know this, but a lot of the discussion, people kind of confuse illegal and legal immigrants. And so when you talk about immigrants getting care, even though they're legal citizens of the United States, and especially if they have brown skin, people don't like the idea of giving them benefits. And so you'll see rules about excluding. A lot of states have things where they say for the first 5 years you can't have any benefits. My own state passed a law like that, which is being contested by an organization I'm on the board of, and we're in court right now on that. But the point is that people have really gotten into this whole immigration thing. The interesting thing is 72% of Americans support immigrants getting health care if they're on a pathway to citizenship. And so I think what's happened with this bill, the politics of the bill over the last couple of years has been because of the opposition to immigrants, they got excluded, especially undocumented immigrants. And what's happened in the future here, though, is that I think the fight is going to be over whether it's going to be a pathway for people who are living here. And that's going to, once they get to that point, I think we have a better chance. But that's probably going to be our opportunity. Elderly and nursing homes, I mentioned all that. The other thing, Also, when we talk about kids, people think about irresponsible parents very honestly. And so when you talk about kids, you have to talk about kids, and you can't make the parents irresponsible. You tell stories. You can't have an opportunity for people to fall into the opposition arguments. So talk about stories where kids, in fact, have been hurt by the system or can't have a future. And don't let them get around to the point of saying it's all because of their parents. Also, it's interesting. These are some of the things that they're also saying. Well, I won't go into it, but the second one, their occupier, on the Occupy 99% thing, they're losing so badly that they're saying to their friends, "We get it. I understand the problem, and here are some Republican, basically, solutions." And the Republican solutions, basically, in this situation, are going to be things like, well, let's just get the job creators going, cut taxes, get rid of the health care bill and all the expenses. And that doesn't solve the problem. And they also say, always blame Washington. So, strategy. The effective strategy, I think, I'm just going to lay into this and I'll give you some reasons why I think this why it works. We have to talk about people, the middle class jobs, the 99%. That is what people care about. The majority of Americans are there on this right now, but we have to make sure the conversation is about that. We have to be positive. We have to educate the base and persuadables. And that means we have to really get out there. We talk about education in this whole thing. We'll talk a little bit more about that, but we do educate, we do move people. And that means that's hard work, that's heavy lifting, and that's some work we have to do. We also have to push back on all the BS that people throw at us. You can't believe all the arguments people throw out. And you have to just say, that's wrong, and this is why it's wrong in one or two sentences. And then you have to say, why are they asking that question, number two. And the third thing you do is say, and this is good for my community and my neighbors and my family because of A, B, and C. You have to do it fast, you have to do it hard. We have to focus always back to the content. And one of the important things in this whole discussion is, and especially for legislators, a lot of legislators are a little bit standoffish about the bill, about the Affordable Care Act overall. And they're saying basically, well, the public's kind of against it, so we should stay away from it. But it's interesting, if they put their arms around their public, their constituents, and say, I'm on the side of my constituent. Here's my constituent, Joy, or say Mary, who has a kid who got excluded because of pre-existing conditions. Or how about the doctor who was up here earlier saying, my employee couldn't afford the care that they were, or the cost was, they got excluded from regular insurance because of having diabetes. How many of us have diabetes? We can't kick her off insurance and leave her out. And if you say, I can't let that happen, in fact, I'm going to fight all I can to make sure that insurance companies, and very honestly, you have to say, and the government works right for these people. We want to make sure government works right. We'll make sure insurance companies work right for our constituents. And not only that, if you're a congressman, which aren't any here today, but if they're any congressman, they actually say, and the bill makes me get my health care from that exchange, from that marketplace. And if I get my health care from there, I'm going to make sure it works for me. And I think that's a very powerful thing. They say that, they win the argument, people are on their side.